Hi, hi everyone, welcome to Research MD. This is Dr. Pramil from United States. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine in one of the large medical schools. We've been doing a series of videos educating the side effects of the drugs. I think we have tremendous response when we did about alternative medicine and the side effects. So today we're going to look at the allopathic medication and the side effects. When I did the alternative medicine, I always hear this complaint from people, are you working for drug companies? Now, I don't have any affiliation. I don't get any money from them. So I just want to make sure I like to say that. Okay, today we're going to talk about a very important drug, finasteride. Now, finasteride, I mean, the complications of finasteride is gaining lots and lots of attention in the United States. The reason for that, finasteride is a drug initially developed for what? Prostate, something called a benign prostatic hyperplasia, or the enlargement of the prostate gland. Okay, that's what they developed this drug. It's a great drug and it works in that. To decrease the volume of prostate. Even I prescribed to my dad, he's been taking for a while. So that's what it is. And then they found out it got a good side effects, right? Because it can grow hair. So people start taking it to have the hair growth. So everybody got excited. I mean, if you watch it like the videos, you can see always on the internet, people trying to sell finasteride. The finasteride, I mean, everybody is selling finasteride. I don't know how they get it, where it's going to. Finasteride use has gone tremendously. Okay? So, male pattern baldness, that's what they use finasteride. Even females are taking it, finasteride for the hair growth. And it does have benefits. It takes apparently 2 to 3 months, but you have to keep on taking it for the hair growth to stay. Okay, but our problem is not about what are the complications people can expect, okay? That's the main purpose of it. And so let's look at the complications. The most common people complain about chills, cold sweats, confusion, dizziness, orthostasis, and the lightheadedness, okay? And they also complain about decreased interest in sex, inability to have an erection, and loss of sexual ability, desire, and the performance. So sexual dysfunction is one of the biggest concern people have. Erectile dysfunction. If I have to take one thing when you take finasteride, one most important thing, you're going to have erectile dysfunction. And also remember, not all of this complication people not going to have it. Only some people, okay? Just don't jump into the conclusion the drug is bad and all that. Not all people are going to, only small number of people, but it's important for you to know about it, okay? Now, the less common, you got bloating or swelling of the face, breast enlargement, we call it gynecomastia, hives and itching, skin rash, you can have it, allergic reaction, you got rapid weight gain, redness of the skin, and tingling hands and the feet is also less common, runny nose, sleepiness, sneezing, back pain, decreased amount of semen, diarrhea, dizziness, headache, and stomach pain. Okay, those are the less common. Now let's look at, this is another study we just kind of looked at it. We did a lot of research. I just want everybody to know this is not, we go back to the scientific world, look at all the complications, what you can have. It's a great study, was published, multi-dimensional assessment of adverse event of finasteride, a real-world pharmacologic vigilance analysis based on the FDA adverse reporting system. Okay, this is very good. So if you look at it again, what does it say? Number one, erectile dysfunction. 3377, the highest number of people have reported this common effects, okay? And also, all of the sexual dysfunction, ejaculation disorder, testicular pain, something striking over here is penile size is reduced. I have never seen anything in my life, any of the drug which is causing penile size reduced. The reason for that, If you look at the internet every day, somebody is like bombarding with ads about like how to increase your penile size. And here you have a drug can decrease the penile size. Okay, just be careful. There was around 398 reports, and is that what, I don't know, is that what you worried about it? You just remember you can have it, okay? And varicocele, male sex, or prostatic pain, infertility, you name it, everything kind of related to the sex. They could have epididymal cyst, testicular cyst, vascular disorder, penile discomfort, testicular discomfort. Please go through the list, and all of them is kind of related something or the other with the sexual dysfunction, okay, or sexual organs, testicle, prostate, and even testicular microlithiasis is common. But if you look at it, I think erectile dysfunction is the number one. Ejaculation disorder is below that. Testicular pain. A lot of people are complaining about testicular pain. So if you're taking that, just remember once you get it, okay? Now let's look at the unusual complications. For this, we have to do a lot of research. We went back to the internet. A lot of case reports we looked at it, okay? So we just kind of talk about the number one. So the first one, an 85-year-old develops liver failure. Now, this poor guy was not talking for the male pattern baldness. He was taking the regular prostatic hyperplasia, BPH. That's what he was taking, okay? But today's world, a lot of other people are taking for the hair, but 85-year-old develops liver failure. Fortunately, he was treated, and I think they used steroids and ursodeoxycholic acid, and it came back normal. But what he noticed, after like 1 month, the liver function test has gone up. Okay. Now, pancreatitis, you have an organ called pancreas right here. You can, the drug can affect it, produce some pancreatic enzymes, severe pain, and people can die from it. Fortunately, this person they were able to treat with intravenous fluids, and he got better. Okay, that you need to know. Now, hematuria and hematospermia, that means, you have some bleeding, a 38-year-old in the bleeding in the urine, and bleeding with the sperm, so noted on this patient. And then there are reports about gynecomastia, okay, that is in male, your breast can enlarge. Again, these are rare side effects, remember that. Now, finasteride-induced clinical oculotoxicity. In this study, they found it can affect the eyes. There's a visual dysfunction in the 50 eyes of the 25 patients. Okay, so it's a large number. So if you're taking finasteride, just be careful about your eye. And then macular. There's a 76-year-old with a rash. There's a big rash on this person, 76-year-old, and fortunately it was okay. Now, let's look up the main thing everybody's afraid of, the post-finasteride syndrome, altered level of neuroactive steroid, different frequencies of AR polymorphism, epigenetic modification, sexual dysfunction. These are the, what's happening in the brain pretty much. Now, every system could be affected. This picture clearly, there was a study, reproductive system, that's what you need to work. Number one is the sexual dysfunction. Peripheral circulation, you got decreased steroid, alkaline phosphatase, brain can affect, even can cause suicide behavior, it can cause depression, kidney function can be affected. In the colon, it can alter the gut microbial composition. In today's world, a lot of people, everybody is talking about this gut microbia, right? It can alter. But every drug you probably take it, you can have it. Now, what are the health risks if you take finasteride for a very long time? You can have diabetes, you can have dry eye disease, kidneys function, and you got fatty liver disease. Those are the long-term complications you can expect, okay? Now, the thing about this drug is, once you take it, you have to take it. There's no A lot of other drugs we take is like, you take the medicine, you get the effect, you stop it, right? This one you need to keep on continuing. The cycle is right there. So it's good to be aware of all the problem, especially the people is you want like, in today's world, we all like to look good, right? We want more hair on the head. So we need, people will take this kind of expected, but be careful. The you can have all this complication, but not everybody is going to have all this complication. Remember that. Maybe like few percent, but the whole purpose we want to educate you. Okay, so if you found any other complication, put it on the side effects so we can give you a feedback, or so everybody knows. So let's have a discussion. Please subscribe to our channel. Without your support, we cannot produce videos like this, and we want our subscription rate to go up. So please, God bless if you help us. Okay, thank you so much for watching again. God bless. Take care.